The number one most prescribed medication in all of the United States, getting dispensed in pharmacies tens of millions of times pretty much every year since this medication has been on the market, is atorvastatin. And in short, it blocks cholesterol synthesis in the liver and lowers total cholesterol, LDL cholesterol, and triglycerides in the bloodstream. Now, why is atorvastatin the number one most prescribed medication in the United States? Well, according to the CDC, heart disease is the number one cause of death in the United States. Specifically, coronary artery disease being the most common type of heart disease, coronary arteries being the arteries that supply blood to your heart tissue, and the disease being atherosclerosis, which is when your artery walls start to get built up with cholesterol and fat, creating this plaque that blocks blood flow to said heart tissue. So who is getting prescribed a statin? So first of all, if you've already had a cardiac event like a heart attack or an ischemic stroke, you are getting prescribed a statin. This is now known as secondary prevention, and we do not want atherosclerosis to further contribute to a secondary cardiac event. And second, if you have an LDL cholesterol level that is greater than 190 milligrams per deciliter, this is a significantly high risk of developing atherosclerosis, and you are going to get prescribed a statin. What we want to do is just lower that level as low as possible. Now, when I say as low as possible, the typical goal for LDLC in individuals with a high risk of atherosclerotic cardiovascular disease, ASCBD, is less than 100 milligrams per deciliter, but the point being that the evidence for this recommendation is strong. So I'm specifically talking to like the ketogenic carnivore diet population. They just need to very closely monitor those LDL levels. So you haven't had a heart attack and your LDL is not greater than 190. That brings us to the ASCBD calculator, courtesy of the American College of Cardiology. And I recommend everybody try this calculator. It's completely free, and it's for people between the ages of 20 and 79. So, if you are between the ages of 40 and 75, you don't have cardiovascular disease, but you have one of the risk factors like smoking history, hypertension, diabetes, and within the next 10 years, your risk of having a cardiac event is greater than 10%, there may be some benefit to initiating a low to moderate dose of a statin medication.